The Pfizer-BioNTech vaccine has been approved for use in the UK. We've got many millions have ordered. George Eustace didn't seem to be entirely clear on exactly how many are going to be arriving here and when. Can you shed any light on that?
So we know that the first batch of 800,000 is making its way to the country now. We know that many of the 50 hospital hubs up and down the country have already received their allocation, and more is expected today. So we know that that consignment is here, and we are expecting in the low millions, so up to 4 million doses, to be with us by the end of December. So that consignment and that distribution is really well on the way now. And we are in real-time communication with our member hospital trusts up and down the country, and they're telling us that they are receiving it.
Really good to get some clarity there, so thank you. Now, of course, we know there are huge logistical challenges to distributing this vaccine, not least, of course, because it needs to be stored at minus 70 degrees. Given that, is it your understanding that it's really going to be given in hospital settings? And will care home residents at the front of the queue, of course, to get the vaccine, will they have to travel to these hospital hubs to receive it?
You're absolutely right, Sophie, that the vaccine does have to be at very, very low temperatures in very specific environment and circumstances. And it is only hospitals who really have the infrastructure and the facilities to be able to do that. But what they are doing is putting in place a phenomenal infrastructure to make sure that those who need to receive it can get it. So they are calling off the records of all over 80s in their areas to get them to come into the hospital to receive their vaccination. So they're setting up separate clinics on their hospital sites. They are working with care home to make sure that they can get care home residents who are able to onto their sites to be vaccinated. And they're also working to make sure that those NHS staff who are at the front of the queue can also receive the vaccination if it's available. So it's a kind of threefold approach, making sure that care home residents and the over 80s, who are both at the top of the list, can get the vaccination before we're in a situation where we'll be able to break those consignments of 975 doses down and actually move them. And that's the situation at the moment. Right now, they can only be administered in hospitals, but trusts up and down the country are working with the MHRA, who is overseeing this process, to see if they can get them distributed more closely to care homes so that they can go into care homes and sort the vaccines for those residents.
You mentioned there NHS workers, because there does seem to be a bit of confusion about this. We were originally told that they would be, at the front of the queue in the first batch of the vaccines, but then it felt that changed. The British Medical Association says that as a result of NHS workers moving down the priority list, frontline workers could die of COVID as a result. Do you think NHS workers should be a priority?
The oversight of the distribution of vaccines falls to the JCVI, which is the Joint Committee on Vaccinations and Immunisations, and they decided on the basis of a precautionary principle about the number of doses coming into the country over a period of time that it was important to focus on those most of dying from coronavirus, and that is the over 80s and those in care homes. And that was because, although we've got 800,000 doses coming into the country, because we need a double dose to vaccinate people, that's really only a distribution to 400,000 people. So what was needed was a way of making sure that those who really needed it most would get it. But what is being adopted now is a blended model. So it's care home residents, over 80s, care home staff, and NHS staff. And we expect the number of NHS staff receiving the vaccine to go up as the number of doses increases coming into the country. So this initial focus on care home residents and staff, as well as the over 80s, was really a precautionary principle as we understand it. Obviously, the NHS isn't in control of the distribution of the vaccine. That falls entirely to the JCVI and their recommendation.
A big part of this, of course, is persuading people to take the vaccine. Dr. Fauci, America's top infectious disease expert, has apologised after telling Sky News the UK's vaccine approval process was less deep than the US. How concerned are you about public confidence in the vaccine, and do you think that could impact take-up?
Well, we know it's very important that there is high take up of the vaccine. There's a kind of three-pronged approach that we need to get through the coronavirus. One is the vaccine, two is effective therapeutics, and we also need to make sure we've got really good testing and tracing. So they are the three elements we need. Vaccines is one part of that. I think it's really important that people understand that the authorization and approval process has been incredibly robust. Yes, it has been shorter other vaccine approval processes, but that's because everything has been thrown at this all in one go, rather than the much more bureaucratic, frankly, process that we've seen with other vaccine approvals, where perhaps the need has been less pressing.